Hello and welcome again to another segment of Dok On Duty, and Brandon Josh Sapang left a message on our wall and he writes, Doc, natapilok po ako sa isang laro namin sa basketball. Ano dapat bang gawin para bumilis ang paggaling ng sprain ng ankle ko? Well, okay Brandon, today we have an expert physiatrist from Health First, Dr. Efrain Gambito, to answer your question. Doc, what do you think?
Thank you, Dr. Rasesi, for that question. Ang sprain ay isang uri ng kondisyon kung saan nagkakaroon ng tears o pagkapunit ang mga ligaments. The ligaments are the structures which are found between two bones. No? They connect two bones and they are found in joints. Ang nangyayari sa sprain is nagkakaroon ng fraying o pagkakapunit ng mga hibla o himaymay ng mga ligaments. Ngayon, sprains can be categorized either into three grades, either mild, moderate, or severe, grade 1, grade 2, or grade 3. Sa grade 1, nagkakaroon lamang ng minimal tears. In grade 2, there is some moderate or partial tearing. And in grade 3, there is a complete tear of the ligaments. The symptoms, of course, will depend on the severity of the tear. Ang typical symptoms ng sprain are pain, swelling, redness, or warmth. Of course, as I've said, yung severity ng symptoms will depend on the extent of the tear. Ang important principle in treating sprains is yung tinatawag na PRICE principle, P-R-I-C-E, which stands for protection, rest, icing, compression, and elevation. How do we do protection and rest? Protecting and resting the joint means immobilizing the joint and not putting weight on the joint for at least 2 to 3 hours or as long as the doctor will instruct you. Icing naman means applying cold in the form of ice compress or ice bags for 20 minutes at least 3 times a day. Compression means wrapping the area through the use of an elastic bandage, or may mga readily available naman sa mga drugstores at sa mga sports shops sa mga tinatawag na compression supports or compression sleeves. Elevation means positioning the joint higher in order to keep the fluid from accumulating dun sa affected area and therefore reducing swelling. Aside from PRICE principle, you need to be started on a rehabilitation program in physical therapy in order to restore strength and stability dun sa joint. So once you are enrolled in a formal physical therapy program, we will be using mga certain modalities or heating modalities in order to relieve the pain, reduce the swelling, and you will be started on exercises for strengthening, to increase flexibility, and certain exercises to improve yung motion saka yung position sense ng joint, or kung tawagin natin ay proprioceptive exercises. You may be prescribed medications to relieve the pain and reduce the swelling such as naproxen or celecoxib in order to help in the healing process. However, you have to inform your doctors if you have certain medical conditions such as hypertension, kidney problems, or heart problems, or allergies, or even ulcers, so that your doctor will be able to prescribe yung appropriate medication or dosing for you. My advice for you is to remember the PRICE principle, that is to protect, rest, ice, compress, and elevate the affected area. Also, you should seek the attention of a medical doctor so that you can be prescribed the appropriate analgesic or anti-inflammatory medications which is appropriate for you. And your doctor will also likewise determine kung may need to do further diagnostic tests such as x-rays or musculoskeletal ultrasound in order to determine yung extent or severity ng injury mo. And lastly, a rehabilitation program or physical therapy program will help you gradually improve and restore the strength and stability in your injured joint.
Thank you, Dr. Gambito, for answering our viewers' question for today. And sana, Brandon, nakatulong ang sagot ni Dr. Gambito sa sprain ng ankle mo. For those of you who would like to ask questions regarding your health concerns, visit our Facebook page and leave a message on our wall. We'll see you all again next week.
This portion was brought to you by Ritemed and in part by Health First Clinic.